Hello, this is the smallest airway that I've ever seen. This is just pertaining to me and my patients that I've This patient, we started working together about 4 years ago. Chief complaint was that they wanted to sleep better and breathe better. Off and on, I'll give you history and I'll also give you barriers for treatment and barriers for treatment goals, special concerns, and I'll discuss kind of what we have to consider when we're working with human beings. Also being therapists, knowing how we can have great conversations with our patients and encourage them to look into other modalities and also respect their wishes and respect how far they want to take things. So just keep all of that in mind. This patient is adult, 57 years old. Chief complaint initially reached out, sleep and one's energy, has been mouth taping, and started looking into buteyko breathing. Saw an ENT, chronic sinusitis, middle and inner ear infections, always sinus pressure, and then, yeah, just a lot of chronic fatigue, head traumas when younger, headaches, and likes to address those issues with acupuncture and Chinese medicine. So that's just kind of where we start off from our consultation. Okay, so now I will go ahead and post pictures that we take upon intake with our assessment, and this was done all virtual. This was at the height of COVID. Yeah, this was literally 2 weeks after they shut everything down. Thankfully, and so this person also is congenitally missing 8 teeth. So keep that in mind. I'll start to list all of the considerations on this screen too, and I discussed poor range of motion, lingual muscles, and we definitely had a decrease in the molar to molar width. So these were all like clinical signs for me that this person really did have a small airway. And we take a control pause measurement in our practice because we do buteyko method to help with breathing reeducation. And so the control pause tells us how well they're able to transfer oxygen. And this control pause on this person was a 13. And so usually you like to see them around 25 or higher. And there was a lot of air hunger present. So a lot of like needing air, like an emergency, I needed air. And then keep also in mind there's 2 concussions, they're prone to headaches, and this person also works outside for their job all the time. Remember how I talked about allergies, chronic allergies and sinusitis. Okay, so now we'll get into facial appearance and the photos. Facial aesthetics, you see that we are concave, if you will, in and around the midface. Almost looks, for lack of a better term, sunken in right here because, remember, missing deciduous teeth or missing primary teeth and no permanent teeth to replace 8. So that's a lot. If you don't have the teeth will migrate and close up the space, hence you'll lose bone. So there's a lot of bone lost on this person, and you can see that visually. It ages you faster. And then the other thing that's noticeable clinically is there's a lot of abfraction and wear. So from clenching and grinding, that also decreases that vertical dimension and makes you appear older than you are. And then lastly, if you think about it this way, if you're not sleeping well, you're also going to age or appear older than you are. So those are all considerations. Yes, it's aesthetics and its appearance, but that plays an impact into our human psyche. So I'm also going to consider that. Okay, so as we go through therapy together, I am informing this patient about options to help with the structure. So, we're limited on resources in their location because they don't live close to me. And they're really limited where they're at. They're in a pretty secluded rural area. Now, this goes on for a while, and there's constant conversation about all of the other things that could support their journey. So after a while, finally, they are looking into those supportive clinical add-ons to our treatment and looking into, surgery and replacing the missing permanent teeth, opening up the spaces, and finally decides to work with Dr. Bill. This airway is, like I said, one of the smallest airways I've ever seen, and this is where we started. So I didn't have this for quite a while. Now, after that, we took a break from working with each other because there was a lot going on with structure and movement and opening spaces and things like that. So all the while, I'm just waiting to hear from them and checking back in and how are things going, and finally hear from them this year. So that was the smallest airway pre-treatment, structural intervention where they're going to open space for her. They did some type of expansion. They did some implants for her on the top. She's waiting to get them on the bottom due to financial reasons. Implants are really costly. Like, I feel really bad because she spent a lot of money on reconstructing her mouth. Once again, like I always say, this could have been discussed when she was younger, and she could have mitigated a lot of what she's going through now. So this is post-treatment, and I still am working to encourage her on looking into treatment options for to see an ENT, an allergist. You can see that there's some pathology. I'm not a radiologist, I'm not going to diagnose, but there's some things going on up there, and we're discussing other options. The reason why I wanted to make this video is there's so many factors that goes into therapy, and we become the advocate for this patient. We become we're navigating, we become, the navigator, the voice, the referral source, everything. So you really have to look at all things, put them on the table, and also start going through them and prioritizing what do we need to address first. And then you have to pull back a little bit because this is so overwhelming. If I were to tell this person, like, your airway's small and your nose is plugged and you have that, like, too much, too much. We know what's going on, but we also need to be human beings and be compassionate and meet them where they're at and understand that they know everything that we think would be beneficial. They're going to make that choice. So, I don't like when you hear, oh, they should have done this and they should have done that, and you don't even know what is going on. You don't know the case. You don't know what the therapist and the patient have discussed. So this is also just an example of how many layers these myofunctional cases have and how much we have to educate ourselves on, because this isn't just out there. You can't just walk in a class and they're going to give you everything. This is from years and years and thousands of patients and things like that. So the point of all this is multi-layered, multifactorial. Be a human being, meet patients where they're at, and make sure you have compassion. Above all, have compassion, have a heart. We're here to help. And if you need anything, have any questions, we do free consultations and love to talk to you. Thanks for listening. This was a long one. Sorry.